audible and visible, please give me a quick thumbs up. If my audio video is all fine. All of you, Maria, Devarshni, Dr. Chip, Tanmay, Shri. Then we have Ria, Shikhar, Yogesh, Shweta, all my dear students. A very welcome and a good afternoon to all my dear students. So let's begin with the first session of the chapter-wise discussion. We'll try to cover each chapter every day, starting with the chapter of basics. Today we have a session on basics. So I will be giving you these classes would be a question and answer type class only. I will be giving you questions, and side by side I will be explaining you the high yield points with respect to that particular questions. Okay, so today we have a basic class and we have a lot of questions with respect to the basics of dermatology. Now let's begin with today's session. I hope everybody is awake, not sleepy, because this is a time of afternoon, and most probably you had your lunch and you may have a little drowsy flashes in between. So please get your tea and coffee with you, because I want everybody to be very, very active at this phase. So we have a lot of new courses, and I just want you to introduce to you with some of the new batch courses. So for the FMG students, the new batch is getting started on 4th of August. I will be the part of this batch course. So all those who want to have a plus course dedicated for the respective exams, please do come. You can have this batch course, which is very beneficial. Even for NEET PG, I would recommend you can go for this particular batch. For next exam, we have the classes from 4th of August. The next is we have a NEET PG test analysis batch course, again starting from 4th. So those who have missed their opportunity of 24th of July, they can join this batch course and they can see the recorded sessions of the last few days. We have an ultra rapid fast track high yield batch course, which is also getting started on 4th August. You have all the top faculties here, and I recommend all of you to please be a part of it. This is the schedule for the next month and next to next month before the exams, the GTs which are scheduled. I request all of you to please give these GTs. They are very, very important for all of you, because it will help you assess the all the subjects very, very importantly. And the second point is it will make a habit of giving the paper all the 19 subjects together, because till now you are giving the subject wise paper. This would be something which is which includes all the 19 subjects. So I will recommend all of you to please go ahead with this grand test discussions. We have 4-year batch courses like for your university exams. So please subscribe using the referral code Chesta10. You can use the referral code Chesta10. And we have this 2-month subscription. I request all my dear students to please utilize this. This is very, very important for all of you right now, because it's only 2 months to your exams. I think it is only 40 days or around 45 days left. So you can utilize that in revising with us. Now, what is the important point why I'm stressing you to take the subscription? Because these classes are only in the evening. So in the early morning, afternoon, you can prepare your own notes and you can revise whatever you have read in the morning in the evening sessions along with this batch course. So please go ahead and take a 2-month subscription using the referral code Chesta10, my name, and you can put 10 ahead of it. We have a very limited time period offer left for the Iconic subscription. I hope you all know that we have 2 types of subscriptions. One is Plus, which give you an access to classes of Unacademy, and Iconic give you an access to both Unacademy and Prep Ladder. The prices of Iconic is very, very reduced right now, but we can expect a hike very soon. So please go ahead with this. And these are the price list. I would recommend 2 months for the NEET PG, 3 months for FMG, and 1 year of either Plus or Iconic for your next pattern examination. So we have a good number. I think we have already crossed 150 students. So very nice, all of you. And please start the questions, starting with the first question. I hope all of you are ready for the first question of the today's session. Starting with this, false about the Langerhans lines are. Which of the following statement is false about Langerhans lines? I think you might have come across this question previously as well. Let's see how many of you know this. False about Langerhans lines are remain constant throughout the life of a person, corresponds to the collagen fibers in the dermis. Incision along these lines produces a better scar, and skin along these lines are least flexible. So please tell me the correct answer of this. False about the Langerhans lines. Very nice. Yogita, Ria, Dr. Sonali. Then we have Shrimani, Lavanya. Very well done, all of you. And those who are joining, this is the first question, starting with the basics. Today we are starting with the basics. Day by day, we'll be progressing or we'll be doing the questions of full dermatology. Again, I'm telling you that these will be a MCQ based session. So for more detail, please join the plus course. Only 20% have answered this question. Tell me which is the wrong statement. Please remember, all my dear students, the wrong statement is option number 1. Langerhans lines are not constant lines. These are dynamic lines which keep on changing. And that is why it is very important for a surgeon to know the age-related changes in the Langerhans lines, because the surgeon has to give the incision along with the lines. If it gives incision perpendicular, it will have a very poor scar formation. So please remember, Langerhans lines, what are these? These are the alignments of the collagen fiber which keep on changing with time. So that is a very, very important question. And I think majority of you have marked it wrong. Just showing you an image. So this is how adult patient with Langerhans lines look like. So you have lines in a different directions. For example, in front it is transverse, in back it is vertical. Okay, over the limbs also it is transverse. So please remember, it is very, very important. Ma'am, I guess volume is low. I hope I'm audible to all of you. Am I audible to all my dear students? Because that is the speed with which I speak every time. I think I've not reduced it. Nothing is changed from my end, but I hope it is audible to you. Just try to increase. Mild slow. Okay, okay. So I don't know why you are loud enough. Okay. So I think it is like comparatively, I'm audible to at least to all of you. So you can just increase the volume of your devices. Chalo. So just have a look, and we are done with the first question. Take it. So if you get a question from Langerhans lines, you will not mark it wrong. Okay, ji? Chalega, done ho gaya. Should I go to the next question? Anyone has any confusion with this, please write it down here, because I want the concepts should be clear. Chalo ji. Next question is on your computer screen. All are true about skin except. All are true about skin except. Your time starts now. Both dermis and ectoderm. Okay, sorry. Both dermis and epidermis. I'm very sorry for this slight mistake. Both dermis and epidermis are derived from ectoderm. Skin accounts for total of 4 kgs. Most of the cells in the skin are keratinocytes derived from the ectoderm, and dermis is made up of type 1 and type 3 collagens in a ratio of 1:8. What is the correct answer here? Please tell me the correct answer. Oh, very nice, Niharika, Devanshi, Maki. Very well done, all my dear students. Prachi. Then we have Vaishnavi, Shrinidhi, Pratik, Hardik, Jayant. Amazing. Shreya, Akhilesh. Then we have Binish, Anandi, Yogita, Naga, Lisha, Shivani. Very well done, all my dear students. The correct answer here is option number 1. Priyanka, it is option number 1. Now remember that there is a wide range of the collagens which are present in the dermis. The amount of collagen 1 is maximum, followed by collagen number 3, and it is considered to be 1:8. Now, epidermis and dermis, they are not derived from ectoderm. Epidermis is derived from ectoderm, but dermis is derived from mesoderm. So please remember, that is why option number 1 becomes incorrect. What is the total kgs, or what is the total weight of the skin? It is 4 kgs. Remember, it is 4 kgs. Most of the skin, or most of the cells in the skin, is keratinocytes, which are derived from the ectoderm. Now, if you remember, the skin is divided into, or skin is made up of 3 parts. Can you name those 3 parts for me? Anyone? What are the 3 structures from which the skin is derived from? So option number 1 is incorrect. Option number 1 is incorrect. Please remember, they are not derived from ectoderm both. Please remember. Yes, very nice, Subbu. You have 3 structures which forms the skin. The superficial most is epidermis. The middle one is dermis. And just below the dermis, we have a subcutaneous plane, which is also known as hypodermis. It is also known as hypodermis. Understood? So these are the 3 parts. The epidermis is considered to be a cellular layer, and which is the most common cell of epidermis? Please remember, the most common cell of epidermis is keratinocyte. The most common or the most important cell is keratinocytes. Anybody tell me why it is called as keratinocyte? Anyone? This was also one of the questions. Why keratinocytes are called as keratinocytes? Yes, because they consist of keratin intermediate filament, which is the pathognomic thing which is seen in a patient of, or which is seen in the skin cell. So please remember, because of keratin intermediate filament, it is known as keratinocytes, keratin containing cells. Cyte is cell and keratino means keratin containing. Clear, all of you? I hope this question is clear. Please give me a thumbs up. Please give me a thumbs up. Yeah, it should be 8:1. Yes, I totally agree with you. Struggling. Yes, you are right for that. Okay, ji. Chalo. So let's move to the next question. I hope this is clear. I hope this is clear. Very nice. Anandi, you have a lot of keratins. For understanding this more in detail, please join my plus course. I will discuss keratin intermediate filament in detail in my plus courses. Very important, because they ask you the pair, which pair is present in which layer. That is a very important question. So please try to answer, or please try to remember the keratin intermediate filaments. Chalo ji. Let's move to the next question. Which of the following cells are not present in the stratum basale layer? Which of the following cell is not present in the stratum basale layer? And your time starts now. Very nice. Ishiara, Kratika, Pratik, Anandi, Imran, Dr. Baby, Maki. Then we have Dr. Sonali, Ruby, Avi, Sheetal. Very nice, amazing, all my dear students. So I request all my dear students to please answer it over the chat section, answer it over the poll. Do not write the answer over the chat section. We have a sufficient time given for each question, so try to answer it over the poll. Only 34% of the total students have answered it correct. Which of the following cell is not present in stratum basale? What is the answer? Where do you see Langerhans cell? Please remember, Langerhans cell is seen in stratum spinosum. Langerhans cell is seen in stratum spinosum layer, which is considered to be the thickest cell layer. Melanocyte, Merkel cell, and keratinocytes will be seen in stratum basale. Now, please remember, I have seen a lot of students marking keratinocyte as the cell not present in the stratum basale. Can you tell me the stratum basale layer, which cell forms the maximum amount? It is the keratinocyte. The stratum basale is equals to keratinocytes, but after every 9th keratinocyte, you see one melanocyte. Okay, so the majority is keratinocytes only. Other than keratinocytes, we do see melanocytes, we do see Merkel cell. So keratinocyte is present throughout the length or throughout the layers of the epidermis. Only Langerhans cells which is present in the stratum spinosum layer. Clear, all of you? Anyone has any confusion? Please do not forget this point. Again, another point is, all these cells, you should know the cell, the origin of these cells, the function of these cells, important markers, and the disease related to it. Very, very importantly asked in your exams. I'm not going to tell you here. If you want to understand it more in detail, please join my plus course. And I think, Subbu, you know very well what is the function of Merkel cell. It is a touch receptor. Merkel cell is a touch receptor. Okay, ji? Chalo. So I think this question is very easy and clear. Should I go to the next question? All of you, all my dear students, we have around, I think we have more than 200 students with us. Please give me a quick thumbs up. I just want you to show how does a normal skin look like. And that is why in the same question, I just want to zoom this. Can you see this is the classical epidermis, and the lower part of the epidermis, they are present in multiple reterridges. It is not smooth. So this is how the dermoepidermal junction look like in a normal skin. Fine. Another question is on your computer screen. Identify this lesion image based. Please remember, in your INICT, you got direct questions from my note. The image based questions were directly from my notes, and that is why I request all of you to please follow my classes, take the subscription, and attend the plus course. My referral code is Chesta10. Now I'm starting the poll for this question. Time starts now. Please take a 2-month subscription. Even if anyone is giving the FMG and if he or she is live in my class, you can opt for 2-month subscription. That would be sufficient even for your December exam. Chalo ji, very nice. Ma'am, for Merkel, okay, I just missed it. Okay, ji, very nice, all my dear students. So for this particular question, this is a very classical image. This is a very classical image of a target lesion. A very classical image for a target lesion. And I hope it is visible. Please give me a quick thumbs up if you can see it. All of you, please give me a thumbs up if the image is visible. Now, please concentrate. There are total 3 circles which is visible. The center one is little dark. It is not even red, it is little darker, little purple or blue in appearance. So this is the central part which is called as necrotic. It is the necrotic central. Ma'am, please. Okay, so I think everybody is having confusion with the ratio of the collagen 1 is to collagen 3. Please remember it is 8 is to 1. Collagen 1 is more compared to collagen 3. So please don't get confused because in that question it was 1 is to 8 and that is why I think there is a lot of confusion going on. Please remember it is 8 is to 1, not 1 is to 8. Okay? I hope that is clear now. Okay? Because collagen 1 is present in a maximum quantity. So it should be 8 for the collagen 1 and 1 is for collagen 3. Okay, ji? Okay. So this comes the necrotic center. This comes the necrotic center. What is the second zone made up of? Anyone? What is the second zone made up of? It is made up of edematous ring. So this becomes the second zone of edema or the middle zone of edema. And the outermost is for erythema or redness. And that is what is seen here. If you see, this is the center one. Then there is a hypopigmented halo, and then there is an erythematous ring. So this becomes a classical target lesion. And can you tell me where do you see target lesions in dermatology? Anyone? Any issue with the audio? Because I can see few people writing audio. I'm having so many messages right now because there are many students. I hope I'm audible. Please say yes if you are, if you can hear me. Chalo. So the one who have written me not audible, please refresh it from your end. Please refresh it from your end. So identify the condition. Please remember it is the target lesion which is very classical of erythema multiforme. Now, can you tell me what is the classical lesion of SJS10 called as? Will you see target lesion in SJS10? Yes or no? Amazing. Dr. Charu, then we have Madhu. Very well done. These are known as atypical target or it is known as targetoid. And can you tell me which zone is missing? Can you tell me which zone is missing? Which zone is missing in targetoid lesions? Yes, you have zone number 2. The edematous zone is missing in a targetoid lesion of Steven-Johnson syndrome and toxic epidermal necrolysis. Okay, ji? Chalo. Loss of intercellular cohesion between the keratinocytes is called as. Again, requesting dermatology caters a very important questions, and in fact, all the short subjects have a very important role to play for your rank. So please do attend the plus courses. These are just the MCQs. In plus courses, we have detailed discussions. Take the subscription using the referral code CHESTA10, CHESTA10. Now here, it's a question from histopathology actually, a pure histopath question. All the options are from histopath. Very nice, Zoro, Anandi, then we have Benesh, Charu, Nadi, Shubham, Dr. Tejashvi, Kratika, Lost. Very well done, all my dear students. Now, I will tell you one by one all the options. One thing you have to remember, the word acantha. The word acantha is used for stratum spinosum. Okay. So we have two things where the acantha is used. One is acanthosis and another is acantholysis. Okay, acanthosis and acantholysis. Now, acanthosis means acantha is stratum spinosum, thosis means proliferation. So, increase in the thickness of stratum spinosum layer is called as acanthosis. And what is acantholysis? Lysis means separation. So, separation of the cells of stratum spinosum is called as acantholysis. Understood all of you the difference between acanthosis and acantholysis? Please give me a thumbs up. So ptosis means proliferation. So increase in the thickness of stratum spinosum is called as acanthosis. And acantholysis means separation of the cells of stratum spinosum. What do you mean by spongiosis? Anybody can tell me an alternate word for spongiosis? An alternate histopathological word for spongiosis. Not eczema. Eczema is a diagnosis where you see this. But I'm asking you an alternative histopathological term. No, it is not ballooning degeneration. Very nice, Dr. Baby. Spongiosis means intercellular edema. Intercellular edema is spongiosis, while ballooning is intracellular edema. Understood the difference, all of you? Understood or not? The ballooning means intracellular. It happens in the viral infections. What happens whenever there is the viral infection? It causes trauma to the keratinocytes. When there is trauma to the keratinocyte, the fluid will enter inside the keratinocytes and they will bulge like a balloon. This is called as ballooning degeneration or intracellular edema. While in the patients of eczema, you have accumulation of fluid in between the two cells, and that is why it is called as spongiosis or intercellular edema. Understood all of you? Please give me a quick thumbs up if this point is clear to everyone. Please give me a thumbs up. So all these terms has been discussed. They are histopathological terms. Remember, histopath is very important. 3 disease, please go and do the histopathology: lichen planus, psoriasis, and leprosy. You cannot miss it. You can expect in your INI-CT, there was a question from vesiculobullous disorder, histopathology. So please do not miss on these important questions and HPEs. Okay, ji? Okay, let's go to the next question. What is a Zinc cell? You have everything here, Priya, Nishu. Acanthosis means proliferation of the stratum spinosum layer. Understood, Neetu? Neetu? Okay, fine. Zinc cell is, please give me the answer of this question. I am having less than 50% of the students who are giving me the correct answer. So I'm requesting all of you to please join a plus course. If you're targeting NEET PG, this is not a good performance. I should say this is not a good performance. So please read dermatology with the full speed. You can expect a lot of integrated questions out of it. So only 49% of the total students are right. Zinc cells are nothing but, these are what? Keratinocytes. And this keratinocytes, they become Zinc cell because of acantholysis. Okay, ji, very nice. So initially the cells of stratum spinosum, they are polygonal, somewhat like this. They are polygonal in shape. And why they are polygonal? Because they are attached to the neighboring cells. They are attached to the neighboring cells from all their surfaces. But what happens because of loss of this intercellular connections, they become round like this. They become round like this with large central nucleus, and this is called as the acantholytic cells, which are nothing but keratinocytes of the stratum spinosum layer. Understood, all of you? Understood? Yes, Dr. Baby, remember, Zinc cells and Coilocyte are completely different. Can anybody tell me what is a Coilocyte? What is a Coilocyte? Coilocyte is a cell which has enlarged because of the damage to the keratinocyte. Yes, it is an example of intracellular edema, very classical of viral infection. And can you tell me which virus? Amazing, caffeine, you are right. It is HPV, human papilloma virus. ठीक है जी, important question. Remember, Coilocyte and Zinc cells are totally different entities. Okay, don't get confused with Zinc cells and Coilocyte. Clear? All of you give me a quick thumbs up if you have understood this question. Very important for your exam. Woods lamp is not used for diagnosis of. Again, Woods lamp become a very important topic. Frequently used instrument in our OPDs. A very cheap investigative modality. Very nice. Zodo, Aruba, Taiba, Pratik, Dr. Charu. Amazing, all my dear students. Very well done. Still, the ratio is less than 50%. So you can assess yourself that how your preparations are going on. If you're doing so many mistakes in basics, I think it's a very difficult thing. Annexin, you want to see the image of what? You want to see the image of acantholytic cell. You want to see the image of acantholytic cell. So this is how a acantholytic cell look like. Please look at this image. There are round cells. These are round cells. Can you see they are very round with a large nucleus, and there is a presence of perinuclear halo. There's a hypopigmented rim which is present around the nucleus. So these three characteristic properties, round keratinocytes, hyperchromic nucleus, and perinuclear halo, corresponds to acantholytic cells. ठीक है जी? Chalo. So Wood's lamp is an instrument which is based on the principle of anyone. Can you fill in the blanks? Wood's lamp is based on the principle of anyone. Namita, Sonia, Banu. Yeah, Mackie, you are right, but can you tell me the exact word? What do you mean by UV? What do you mean by UV? What happens? No, yes, you are right. All of you are right, but what does it do? Please remember, it is based on the property of fluorescence. It is based on the property of fluorescence. What is the property of fluorescence? That when an object uh, take a light or absorb a light, it emits a light of a higher wavelength. This is called as the property of fluorescence. So only those objects will be visible under the Wood's lamp which possess the property of fluorescence. Please remember, in lichen planus, there is no object or organism, nothing possesses the property of fluorescence, and that is why the Wood's lamp finding is not seen. Anybody can tell me what is the appearance of a vitiligo patch under Wood's lamp? Anyone? It becomes ivory white. What do you mean by ivory white? Ma'am, you are just using a word. Vitiligo is white. What do you mean by ivory white? Can you tell me what exactly happens when you put a Wood's lamp on a vitiliginous patch? Can you tell me what happens? Vitiligo lesions are anyway white. So why I am mentioning that it becomes ivory white? What does it mean? Anybody can tell me the answer of this question? Anybody can tell me the answer of this question? Chalo ji. I want to show you this image. Just look at the above image. Please look at the above image. Please look at this image. Can you see the hypopigmented lesions or depigmented lesions over the upper lip and chin? Yes, obviously you can see some hypopigmented or depigmented lesions on the upper lip and the chin of this female. And here also you can see some depigmented patches just at the proximal nail fold. These are white patches. But look what happens when I put a Wood's lamp. It becomes more white. It becomes ivory white. It becomes more white, and this is called as ivory white appearance. Now you can easily differentiate the vitiliginous area from the normal skin. You can have little difficulty in the upper image. So just looking through the naked eyes, you might not 100% tell the patient that this is a case of vitiligo. But when you put a Wood's lamp, the vitiliginous part becomes more white and the surrounding parts become dull. Okay? So this is how you can use vitiligo, or you can use the Wood's lamp for making or for confirming the diagnosis of vitiligo. In porphyria, what is the color? Porphyria, you will see red color of urine and blood. Okay, now it is not the skin. Here in porphyria, you're talking about the body fluids, that is urine and blood. And in pityriasis versicolor, it should write versicolor. It becomes yellow. Okay, ji? It becomes yellow. Done? All of you clear with this question? Should I go to the next question? Please give me a quick thumbs up if everybody is ready for the next question. Amazing. Elevated clear fluid filled blister of 2 centimeter size is known as. I want 100% answer for this question. Very nice. Charu, Kritika, enlightening. Harini, Aruba, Mridyushman, Pratik, Shweta, amazing, all my dear students, amazing. Yes, you're right, caffeine, coral red for erythrasma, for tinea capitis, it is bluish green. So you have a lot of objects which has the property of fluorescence, and wherever you have that property, you can use the wood slab for diagnosis. So this is a clear-cut case of a bulla, which is a fluid-filled lesion of more than 0.5 or 1 centimeter. And suppose if it is less than 0.5 centimeter, can you tell me what would be the name then? If it is less than 0.5 centimeter, the answer becomes vesicle, option number C. So with this, we are done with the questions of basics. I hope you have enjoyed this class. I request all my dear students to please be live every day at 2 p.m. as well as 11 a.m. for these classes. This would be very, very beneficial for you. And for more discussion, for detailed discussions, I would request all my dear students to please subscribe to Unacademy, this 2-month subscription using the code CHESTA10. So take care all of you. Bye bye and good day.